Good evening. I'm Dr. Smarnika from IIP Digital Media team. I will be the host for today's webinar on pulmonary rehabilitation with resource person Dr. Nikhil Chakravarthy, being organized by IIP Women's Cell Goa. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP Digital Media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms like Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow IAP profiles on these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notifications of our live webinars. In the playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehabilitation, etc. for easy access. The social media links will be shared in the chat shortly. So with this, I would like to invite Dr. Lavi. Dr. Lavi, please give us an introduction to our speaker, and from there you can carry forward. I would just like to inform that the vote of thanks also will be given by Dr. Lavi, and today our Q&A session will be taken by Dr. Sadhvi. So all of them are the part of the IIPWC Goa. With that, I would like to give it to Dr. Lavi. Dr. Lavi, please take over.
Okay, thank you so much. A very good evening to one and all, and it's my privilege for giving me the opportunity to introduce our speaker for today's webinar. I, Dr. Lavi Jain, I would like to welcome you all on behalf of IAP Women's Cell Goa for the series of webinar. Today's topic is pulmonary rehabilitation. It gives me immense pleasure to introduce our speaker for today's webinar, Dr. Nikhil Chakravarthy. Dr. Nikhil Chakravarthy is an expert in cardiopulmonary rehabilitation along with certification in fitness and ergonomics. He graduated from Manipal University and worked as a senior physiotherapist in Manipal Hospital, Bangalore for a period of 5 years. Later on was in charge of physiotherapy at Yashoda Group of Hospitals where he worked at the challenging times of pandemic and currently working as head of department at one of the leading cancer hospitals in India at Basavakatakam in Indo-American Cancer Hospital and Research Institute. Thank you. I now request to Dr. Nikhil Chakravarthy to take over. Welcome. I welcome you, sir.
Yeah. Am I audible?
Yes, sir.
Yeah.
Yes, Dr. Nikhil, you are audible.
Yeah. Hi. A very warm good evening to one and all. So, first of all, I would like to thank IAP Women's Cell Goa for giving me such a wonderful opportunity. And also, I would like to thank all the panelists, Dr. Lavi, Dr. Sadhvi, for their patience and for the wonderful introduction. Thank you so much. So, without any further delay, we will get into today's topic, that is the pulmonary rehabilitation. So today we'll be talking about, I'll be covering what is the definition of pulmonary rehabilitation and what are the outcomes which we usually take and what are the goals for a physiotherapist in regards with pulmonary rehabilitation. And the crust of today will be the components which are involved in the pulmonary rehabilitation. And lastly, the physical therapy management of pulmonary rehabilitation. So pulmonary rehabilitation or the rehabilitation, especially for COPD patients, has been existing for more than 25 years now. Only it was in 1974 that American College of Chest Physicians defined pulmonary rehabilitation and described the aspects of care. But the official statement was given by American Thoracic Society, which is even considered as gold standard, which is being followed even today, was given only in 1981. They have described the pulmonary rehabilitation, they have given the guidelines for it. So I have included this specific image because I always believe that pulmonary rehabilitation or any sort of rehabilitation is always a team effort. That is, if you see the picture, there are a lot of people who are involved here. So whenever you're talking about a rehab, it is always a team which comes and produces every insight from each and every individual's perspective. So it is always a team effort. So it is always a holistic approach. So that is why I've included this slide. That is, I wanted to tell you that pulmonary rehabilitation also runs as a team. And coming to the definition that is given by American Thoracic Society, that is, it is a comprehensive intervention based on a thorough patient assessment followed by patient-tailored therapies that include but not limited to exercise training, education, behavior change designed to improve physical as well as psychological condition of the people with chronic respiratory disease and to promote long-term adherence to health enhancing behaviors. I know it is little confusing. You just have to take the crust of it. That is, it is always patient-tailored therapies. That is, it is always once you do an assessment, it is what a patient needs is really important. So it is always a tailor-made approach. It is not a generalized approach of any rehabilitation, which include exercise training. That is the components of rehab. That is your exercise training. It becomes really important for a therapist to educate the patient. That is your education will also come into picture. The behavior changes. That is, if the patient was a smoker, how you have successfully asked him, that is smoking cessation programs you have conducted, and misuse of alcohol, and also how you have trained him physically and psychologically. Psychological components like quality of life and all these things will also come into picture later on. All these things we are addressing to a chronically respiratory disease, that is patients who have lung issues. And the most important aspect of any rehab would be long term adherence. Always remember, long term adherence is always fruitful. Whenever you do an any exercise or an exercise program within a short period of time, you will not get good results. Or only when you have long-term adherence to any sort of rehab, it becomes a meaningful rehab. That is, you will get good results. Then the next one is, yeah, then the next one I wanted to talk about is the outcomes. So what are the outcomes? Whenever we are talking about any rehabilitation, we usually talk about the outcomes. So what is the outcome, what we are expecting? Whether it is outcome is nothing but a prognosis. So whether the patient has deteriorated or whether the patient has improved after your particular rehab or the intervention. So definitely you will have to have the outcomes of pulmonary rehab. So outcomes can be broadly classified into two types. That is outcomes of improvement as well as outcomes without improvement. So the outcomes of improvement would be your respiratory symptoms, that is the amount of dyspnea you have, the amount of secretions you have, and all these things will be the respiratory symptoms. And the quality of life, your respiratory muscle function, that is your diaphragm, external oblique, internal oblique, all these respiratory muscles, and also the frequency of hospitalization. How frequently you are getting hospitalized will also play a crucial role in an outcome measure. And your psychological status, that is your quality of life. There are so many outcome measures which you can take, that is respiratory questionnaires or your SF-36 quality of life. All these things will also are the psychological status which represents the outcome of improvement. So all these things will come under the improvement. That is, all these outcomes can be improved with your rehabilitation program. Certain outcomes are there which cannot be improved, wherein you cannot reverse the situation completely. That is your heart condition, your lung condition, or your mortality rate, or your maximal aerobic capacity. All these things will not have a significant difference no matter how much of a rehab you give. All right, so these are the outcomes. So coming to, so the next important thing is how a physiotherapist has to design what are the goals of pulmonary rehabilitation. So always remember, the goals of an individual must be specific and pertinent to an individual lifestyle. So it should always be a tailor-made one. So how will you come to a conclusion like that? So always remember, you have to do a detailed assessment and evaluation of the patient before you do a goal setting. And goals should always be realistic and small so that you can achieve it. So for this, there is a simple slide. I'll just share that with you, how a goal should be. So goal should always be smart. That is, it should be very specific on what you are working on, and it should be a measurable one, whether you have achieved your goal or not, and it should be attainable. As I told you, if it's small, it is attainable very quickly. So always remember, set your goals, small goals, and you try to achieve them. Take one step at a time, and it should be relevant. What is the need of, what is the purpose of the rehab, and it should be relevant, and again it should be time based. within what particular time you are achieving that goal. So again, it becomes important. And the other goals, important goals, would be improvement in health related behaviors. That is, as I was earlier telling you, health related behaviors is asking the patient to stop smoking if a patient is having COPD disease, and ask him to do a self-reporting tool, whether he has come down on his cigarettes or whether the smoking cessation program was successful. And the second goal would be improvement in clinical symptoms. That is the amount of dyspnea or the amount of sputum production or the amount frequency of hospitalization which the patient had. So all these also would be coming under the goals of pulmonary rehab. And improvement in function and daily activity tolerance. Again, it becomes really important to check what is the daily activity tolerance, whether the patient is able to walk, whether the patient is able to do a timed up go test, whether the patient has become quite independent after your rehab. All these things will also come into the picture. The most important and underrated from a physiotherapist point of view is improvement in nutritional status. I know dietitians also play a picture, but make sure you are also going through those reports, because whenever you have very poor nutrition to a patient, the patient is totally emaciated, and you have, if the patient is having very poor protein or albumin, again you have the nutritional status which is disturbed. Then the improvement in confidence and self-esteem again becomes really important. That is, patient should have enough confidence and self-esteem to deal with the rehab. So all these would be the goals of the pulmonary rehabilitation. And coming to the structure of pulmonary rehabilitation, that is, all the components of the pulmonary rehabilitation can begin during the acute inpatient program itself. You need not wait till the patient get discharged. You can start the pulmonary rehabilitation program even in the acute phase. That is, it can be given at three different levels. That is the inpatient rehabilitation, or the subacute facility, or also in a freestanding clinic. So you just have to start the rehab. It can be done from anywhere, and you just have to, consistency is the key, is what I believe in. So you just have to be consistent with the patient, and patient should have enough psychological boost and motivation. And as I was telling you earlier, now we will see who are all the team members in the rehabilitation. So definitely the patient, also the pulmonologist, the program director is usually the physiotherapist who will be designing the rehab protocol, and also there will be other team members. So all these team members put together, they try to develop like a team, and they work holistically for the betterment of the patient and to improve the quality of life, and also the to achieve the individual goals of the patient. So in this figure, you can clearly see the pulmonologist, who is the center head of the patient, the whole rehab. Then you have the physiotherapist, the psychologist, the pharmacologist, and also the dietitian who will look into the nutritional status of a patient. All these team members put together, they try to achieve the rehab program. Then coming to program components, that is, there are three components, that is your exercise and functional training. So it becomes really important in instructing the patient to have energy conservation techniques, and pacing also becomes crucial, because it is very easy for me to tell the patient, make sure you get up and try to sit or take a stroll and come. But even with very small body movements, I have seen patients getting completely breathless. So it becomes really important as a therapist that you instruct them how you can pace your activities or how you can conserve your energy. So energy conservation becomes really important. So you are supposed to have a talk with the patient, and you have to train him on how you can conserve the energy. Then the second most important thing is exercises which will improve your strength, flexibility, and also endurance become a major composition of the rehabilitation. Because whenever you have good strength, flexibility, and endurance, your rehab will become easy, and the patient will be able to achieve all the goals. So the in the program components, the first would be exercise and the functional training. Then the second would be the most important, that is the education and the functional patient training. So, as a physiotherapist, whenever you get time, don't just try to spend with the patient himself, but make sure if you have the attender or the family next to them, make sure you're telling them what is the kind of problem he is in, and try to educate them. Education is really important because once the patient is in hospital, as long as the patient is in the hospital, he is in good hands that you are able to deal with the circumstances. But once the patient gets discharged and goes home, education becomes really important. That patient party or the attender should know what they are supposed to do. So always remember, you need to have a group session between the patient spouse or the family members, and it should be an open session. It should be an open session so that their side questions also you can facilitate. So the topics of education usually can be the amount of disease he's having, the early detection of any sort of illness, or the medical management, how you are supposed to medically manage, and the most important, the crust of today's topic, that is the use of oxygen. Because most of the patients, what we have seen in this pandemic COVID, most of the patients get discharged with supplemental oxygen, they go home. So you are supposed to tell them very clearly when you are supposed to use a low flow device, when you are supposed to use a high flow device. So use of oxygen, again, it becomes really important. So that is the reason why patient education is very crucial, and training. Along with this, I have seen lot of patients who have bronchiectasis or cystic fibrosis where there is copious sputum. So it becomes really important for a physiotherapist to teach them techniques like autogenic drainage, postural drainage, or any other FET, forced expiratory techniques, or if the patient is very breathless, how you can relax, or if there is any accessory muscle usage, how you can decrease the respiratory rate, how you can initiate the diaphragm and teach them diaphragmatic breathing. All these things also become important. That is before they get discharged, or this also becomes the part of the treatment program, which is the which is a part of the pulmonary rehabilitation component. Then the next one is psychosocial management. Again, this forms an integral part of the rehabilitation as chronic illnesses cause stress in the whole family. For this, we have a very good outcome measure, and there are a lot of studies on this. That is your hospital anxiety and depression scale. Whenever you have a patient in the hospital, all the people also and along with the patient will become very anxious, and usually the patient is in more of more in sort of depression. So always remember, you are supposed to ease off the stress from the family, and also coping strategies, stress reduction, and support systems also becomes very necessary. Sometimes patients may need some vocational services. Then till now we have spoken about the definition, then the outcomes, then also the goals, and the team who are all included. So now it becomes really important who is eligible for the pulmonary rehabilitation. So I'm talking about patient candidacy. So any person with primary pulmonary disease or who is at a risk of developing pulmonary disease will be an ideal candidate for the rehabilitation program. So person with diagnosed respiratory disease and documented functional limitations can fit into pulmonary rehabilitation program. And coming to physical therapy management, so the most important thing, that is patient evaluation procedure. That is, physical therapists should always evaluate chart reviews, laboratory tests, interviewing the patient, performing physical examination, and also assessment of activity tolerance. I have seen most of the young therapists who have worked, who have joined newly into an organization or into a rehab, they just try to go ahead. They'll just see the file. They will not even see the file. They'll just go and start giving chest physiotherapy. Always remember, this is the biggest blunder most of the new therapists do. Always remember, this is a golden thumb rule that before you start any sort of therapy, the most important thing would be just go through the file, that is your chart review. Once you go through the file, you will know what is the condition of the patient, how you can individualize the goals, and what you can do the best to get the best results of the patient. Until and unless you know what is the condition of the patient, you cannot go ahead and treat the patient. So it becomes really crucial about the chart review. So that is what charts should always be reviewed for current pulmonary diagnosis, prognosis, and also you will know the staging of the disease. Never touch the patient without going through the file or reading the chart. or whatever is documented already. All the treatments like the surgical, oral, inhaled medications, oxygen therapy, you should be able to identify and you should know all the treatments are being done. Then the most important thing is you can individualize the goals and treatments according to the needs of the patient if you go through the chart. So that is why it is always important to go through the chart and review the patient completely before you even start treating the patient. Then the most important thing is again the patient interview. Always make sure you should communicate good. Communication is a very important in physiotherapist job. So always remember, try to gather a lot of information from the family or spouse and you try to interview them. And most of the times try to keep these questions standardized so that you will not miss many points. It is same like our assessment. So we usually follow the physical therapy assessment. Same thing, if you have the questions which are being standardized, most of the topics you will be able to cover. That is the use of tobacco, your usual activity level, what is the amount of exercise he's been doing if he was doing earlier, then what is the symptoms, then also support from the family or friends. So if these are few examples, that is if the standardization is there, you will not miss out on many points. So again, the patient interview becomes really important. Then the most important thing, that is your patient examination. Whenever you try to examine the patient as a whole. That is your body weight and height, that is your BMI. Just go through the whole examination. If the patient is, see, whenever you do the whole examination, you will obviously come to a conclusion that if the patient is very obese, so you can bottom down, you can just come down to a bottom line that ventilatory effort of such patients who are very obese is very high. So obviously, most of the patients will become little breathless even with minute activities. And there is a strong evidence that obesity is very strongly connected with inflammation. So if the patient is very obese, inflammation is also very high. So make sure your goal would be reduction in the weight will also be your goal, so that indirectly the ventilatory effort will also decrease. And coming to chest evaluation, if there is any dysfunctional breathing or if there is any accessory muscle usage, try to use a post position wherein if you make the patient lie down in a semi-fowler's position or forward kneeling, the usage of accessory muscles is inhibited so that you will enhance the diaphragmatic breathing. So all these things again become really important in chest evaluation. And coming to musculoskeletal, because most of the patients are having the respiratory problem, if they move, they might become breathless. That is the reason most of the patients get confined to either bed or chair. So musculoskeletal examination again becomes important and you need to address it. So whenever most of the times in the ICUs, if the patient is bedridden, you try to, if the patient is bedridden for 2 or 3 days, there is something called as deconditioning which will happen. So whenever you try to ask the patient to stand, they'll simply buckle. That is because their quadriceps have been very weak. So, but here, why you have to address the quadriceps not only to stand, but also your quadriceps, that is your front of the thigh, is otherwise called as peripheral lung. So you can indirectly enhance your breathing pattern also in a better way once you address your quadriceps muscle. So your musculoskeletal examination also becomes very crucial. And the activity assessment, whether he is able to do all the activities by himself or whether he is dependent on somebody, and all these things also become important. And coming to treatment interventions, so the most important thing would be what I tell you is the pulmonary care. So the main emphasis of pulmonary care is removing the excessive secretions from the obstructed airways. So always remember, if there is too much secretions in the airways, the resistance will increase and your work of breathing will also increase. Whenever you have increased work of breathing, your respiratory rate is too high. So you have something called as bronchial hygiene. So always remember, teach the patient a proper bronchial hygiene therapy so that your airways are clear and you are away from these excessive secretions. And how is this possible? Performing a series of deep breathing exercises and also forced expirations help in your bronchial drainage. That is, Those things are little different. I will not go into further details because those treatment options will be autogenic drainage, postural drainage, forced expiratory techniques, and PEP devices, which we use like acapella and flutter. All these things again will help the secretions to come out easily. And what is the short-term goals of pulmonary care? So it will definitely help to improve the breath sounds and also the volume of secretions which are being produced. So these are the short-term goals whenever you have a proper pulmonary care. And what would be the long-term goals? Whenever you adhere to a proper pulmonary care, that is, you stick to your routine, definitely your frequency of the hospitalization is reduced and also the length of the stay of the hospital is reduced. And last but not the least, your baseline pulmonary function will be maintained. You will not go very bad because most of the times, if you have secretions which are being deposited in your airways, that is the reason why you will have lot of infections and admission to the hospital happens. So once your bronchial hygiene is good, half of the problem is solved, and automatically there is less airway resistance and the work of breathing is also very low. So you will be able to breathe better, your respiratory rate is also reduced. So indirectly, you will not get hospitalized or you will not get infections. And the most important thing again is the functional training. So functional training again equally becomes important when the patient has significant amount of weakness, fatigue, or severe dyspnea. Whenever we are talking about a pulmonary patient, most common complaints are weakness, fatigue, and dyspnea. Even small movement can actually become make the patient very breathless. So the goals would be adapting to the environment to improve the ease of performing activities. So you should teach them how you can move with ease and also altering the performance of task to decrease the energy cost. So you can try to alter or minimize the body movement so that the energy costs are less, so the patient will not become completely breathless. So these are coping strategies and incorporating methods to relieve some symptoms, that is taking rest or going into a proper position wherein you again do deep breathing exercises or going into a semi-forward position or relaxing postures wherein you can come forward and forward kneeling. Again, you are trying to focus more on your diaphragm and facilitating the diaphragmatic movement. So all these things also become important in functional training. Last but not the least, it is very underrated, but environmental modifications also become really also have a huge impact. So identifying the ADLs which are strenuous and modifying the environment accordingly. You have to identify what is making my patient stress out or what is that thing which is making my patient completely breathless. So you try to modify such things. If the patient is standing in front of a, if he has to brush his teeth, if the toothpaste or the brush is very high, so try to bring it down because the upper arm movement will make you more breathless. So try to modify such simple things, that is placing the equipment in convenient locations, as I told you, so that you can avoid bending or lifting can be minimized. So you're modifying the environment and locating the chairs at appropriate places whenever the patient needs rest. Whenever the patient is in the hospital, at the end of the corridor, you'll always see a table or chair or a sofa which is always there. So whenever they are walking, if they get breathless, they can sit there, gather some breath, and again get up and walk after some time. So it becomes really important on what kind of environmental modifications a physiotherapist also can do, or you can give inputs to others also that these can be done so that the patients cannot be completely strenuous or cannot become completely breathless. So the last one is again improving the ventilation in the bathroom and kitchen areas in which dust, smokes or fumes may also cause respiratory symptoms. So trying to improve the ventilation so that these episodes cannot happen again and again. So we have seen functional modification, environmental modification, and then here comes the task modification. So all these things also you are supposed to address along not only the physical aspects or physical therapy part of it. So you need to look at patients' problems as a whole and try to address from all the corners so that he will get into a better shape. So tasks can be modified by including energy conservation techniques, as I already earlier told you, that is slowing down the pace, ask the patient to slow down a bit, and minimizing large body movements. Only if needed, you try to move all the body parts, or else you try to minimize the body movements, because whenever you see the oxygen dissociation curve, it will be like this. It is a sigmoid or S-shaped curve. So the dissociation or the desaturation happens at one go. The problem is whenever you try to make the patient walk, suddenly patient collapses. That is because the dissociation happens very quickly. If you have seen the diagram, and again it will take a very long time to again get back to the normal baseline saturation. So it is always important to see accordingly and try not to move the patient completely. Or even if you want to move, make sure oxygen is readily available. That is, there is a lot of evidence on early mobilization with supplemental oxygen also. So you are supposed to make sure that your oxygen is also ready if you have to move, and setting prioritize and organizing activities. And each activity can be broken down into a smaller tasks. That is how digestion happens. Same thing, each activity can be broken down into smaller tasks so that the task will become easy. And the last one is the relief of dyspnea, the most distressing symptom for most of the pulmonary patients, that is relief of dyspnea. How do you do it? So whenever you do a controlled breathing, automatically you're facilitating the diaphragm and you're trying to bring the respiratory down, and you're correcting the breathing pattern. Whenever you're correcting the breathing pattern, it is a vicious cycle. Whenever you're trying to correct the breathing pattern, your work of breathing is again decreasing, and you are playing with the postures also. You will tell them what is the relaxing posture and try to go into this posture, do a forward kneeling or lie down for some time. And using these relaxation techniques, you can definitely have a controlled breathing, and eventually you can get relief from the dyspnea. And improvement in respiratory muscle functions comes in later on stages, where you will work with an inspiratory muscle trainer so that the respiratory muscles strengthen. Whenever your respiratory muscles are strong, what happens? The fatigue component sets in much later. If the respiratory muscles are very weak, because of the fatigue, continuously they are firing, they'll end up in fatigue and you will end up in breathlessness. So you are supposed to work on the strength part of the respiratory muscles using inspiratory muscle trainer. That is the device. Once you do that, definitely you will see a lot of relief of dyspnea, and also patients will not become breathless so easily. So till now we have seen the physical therapy part of it. Last but not the least, the most important aspect would be physical conditioning as well. So what is overall physical conditioning? That is, three things will come into physical conditioning part whenever we are talking about a physical conditioning. That is your strength, your flexibility, and your respiratory muscle strength. Also, all these things come into your physical conditioning. As I told you earlier, increasing strength improves patients' ability to perform activities in a better way. So, strengthening always helps. Always remember, intensity of the exercises should be low, but the frequency should be high. Don't stress the patient completely. So, always tell the patient, don't do with too much intensity. Keep the intensity very low, but frequently you try to do, then you will be able to achieve whatever results you want in an acute phase. And that is why the second point I have clearly mentioned, that program should always start with very low resistance and light weights. Later, you can increase the number of weights or the repetitions later on stages. But whenever you're starting something to a new patient, always start with low resistance and use always very light weights. And upper body training, as I told you earlier, upper body training, whenever you're training with the upper body, that is, sometimes some people unknowingly use arm ergometry in respiratory patients. So never use arm ergometry in respiratory patients, because ventilatory work will be very high and patients will become dyspneic at within no time. So always remember, whenever you're dealing with a respiratory patient or a patient with respiratory illness, make sure you work more on your lower limbs. That is, you try to use your quadriceps, hamstrings, and all these muscles rather than using upper limbs, because there is no point. Your patient is getting breathless very rapidly if you're having upper body training. So strengthening becomes really important. And again, the next point would be flexibility. As I told you, why flexibility is again really important is whenever you see most of the patients who are uh, having respiratory illness, they are most of the times confined to bed or to a chair, because whenever they move, they feel that they will become very breathless and they will collapse, or they will become very dyspneic. So usually whenever you see their posture, there is reduced mobility and there you will see a lot of changes in the posture. So again, here the flexibility plays an important role, and flexibility exercises should also be included to improve the joint range and also stiffness. And last but not the least, it is always important to do flexibility exercises to prevent the injuries. And flexibility exercises also work like a work warm up and a cool down phase of exercise also. And these will flexibility exercises help to relieve tension as well as the anxiety of the patients. So strengthening, flexibility, and inspiratory muscle training. As I told you, the last one, which is really important, is inspiratory muscle training. So for any training, respiratory muscles, patient is required to breathe against a resistive load. That is, I'll just show you a figure. This is the inspiratory muscle painer. That is, you are blocking the nasal path and you are asking the patient to breathe in and breathe out through inspiratory muscle. So you are supposed to ask the patient to breathe in through the inspiratory muscle. There is a resistive load, there is a spring attached to it, and you can either tighten it or loosen it. Once you are tightening it, it becomes more and more tougher for the patient to breathe in. So automatically, it is like sending your respiratory muscles to a gym. Whenever, if you want to strengthen any sort of muscle, you have to load it. This is the simple concept. If you have to load the muscle, only then the strengthening happens. So you are supposed to give the device to the patient, ask him to breathe in through the device, and there is a knob which can either tighten or loosen. So based on what is required, you can do it. So that is called inspiratory muscle training. So patient should be able to withstand more ventilatory work with less respiratory muscle fatigue. Once he starts this inspiratory muscle training, it becomes easy. And outcomes of inspiratory muscle training can be documented by recordings, increases in the resistance which he is blowing, or also in the maximal inspiratory pressures. Whenever you see maximal inspiratory pressure, this maximal inspiratory pressure comes in PFT. Whenever you see PFT values, you will see these maximal inspiratory pressures. So you can use these as an outcome measures also. Whenever you have taken a respiratory patient into your study, you can use these as outcome measures once you start the patient on inspiratory muscle training. So all these things also become really important, and all these things should be addressed along with the pulmonary care, along with the exercise training, your strengthening, your flexibility, and also your inspiratory muscles training should always be addressed for pulmonary patients. And coming to summary, that is, always focus on the functional outcomes, individual lifestyles, especially for those with or at risk of pulmonary disease. And rehabilitation program should always include, as I earlier told you, it should include the exercise, the functional training, education, which is most important. Education should be done to the patient as well as the family members, and also the patient training, how the patient can cope up after going back home, how he can keep himself healthy, what is the bronchial hygiene therapy, all these things you can also tell the patient. Education, patient training, and also psychological management. That is the most important. Again, the psychologist, as I told you, it is a team effort. So nutrition dietitians will look into that nutritional component. The psychological part would be looking at the psychologist. The physical therapy part can also be taken care of by the physiotherapist. All these people put together, they form the complete rehabilitation team. And respiratory treatment techniques involves clearing of secretions, relieving of dyspnea, and also improving the breathing pattern, and using respiratory assistive devices like CPAP or BiPAP or all these machines which are required, so that the work of breathing is reduced, and also you can rehabilitate the patient completely. All right. Thank you. I can, if you want to ask me anything, yeah, the session is open.
Dr. Sadhvi will be taking the Q&A.
Thank you so much, sir, for the informative session. I would request the attendees to put up the questions in the chat box.
I think we have got a question.
Okay, I saw the, how can I treat a PA shoulder patient with asthma? So PA shoulder has nothing, it doesn't have too much correlation with asthma. You can just, what happens in PA shoulder, your joint is stiff basically. There are three stages, that is freezing, frozen, and thawing. So whenever you try to do the exercises, so make sure, as I told you, keep it very simple. You can treat him step by step. So you try to start with simple range of motion activities, then give him rest, then you try to mobilize the joint, then give him adequate rest, and make sure he is in good relaxing positions also. If possible, ask him to forward kneel for some time, then ask him to lie down if there is a couch available, and most important thing is, make sure you are having intermittent deep breathing sessions, so that you, most of the times what we tell is breathe through the pain. So always remember, whenever you're trying to breathe, you will be able to mobilize in a better way. So try to do intermittently breathing exercises also, so that you will be able to mobilize the joint. Yeah. So don't do it continuously. Have intermittently gaps. Then you can do. That is not an issue.
You,
What?
sir. There is another question, which is, what is the role of bicarbonate in ABG?
Yeah, so ABG is whenever you have too much of acid, that is CO2, you will have this acidosis, respiratory acidosis, whenever the CO2 is too high. That is, the normal value is between 35 to 45. If the CO2 is very high, then it is called respiratory acidosis. If it is correct, then it is normal. If it is very low, then it is respiratory alkalosis. So what is the role of bicarbonate? So whenever you, that HCO3 component, that is the, there are two types, that is respiratory as well as metabolic. So whenever you try to, the bicarbonate is really important in case of, because today is respiratory component topic. So if there is too much high of CO2, it becomes acidosis. So always remember, you are trying to wash out the excess CO2. So you try to wash out the excess CO2 through pursed lipped breathing. And there is something called as IE ratio. So you try to, instead of inhalation and exhalation ratio, so you try to inhale and increase the exhalation time, so that you are exhaling completely, that is, you are washing out all the CO2. Then you are trying to achieve the homeostasis. So it becomes really important that the role of bicarbonate or the HCO, coming back to, instead of respiratory acidosis, coming back to alkalosis component becomes really important. So you have to wash out all the CO2, which will address the issue automatically. Yeah. How to improve ventilatory strength if the patient cannot do spirometer? So ventilatory, if the spiro first thing is, spirometer is only used for lung expansion. It is not an inspiratory muscle trainer. Always remember, how to improve your ventilatory strength is, your ventilatory strength can be improved only when you load the muscle. So first start with basics. There are segmental expansion exercises. As the, just place the therapist's hand over the lower basals of the lung. Ask him to breathe completely till the, till you feel that there is enough lung expansion which is seen. So that is your segmental expansion, then your thoracic expansion, all these exercises. And the most important, if you notice, before even you improve the ventilatory strength, the first thing would be dysfunctional breathing. So whenever you come across a patient with dysfunctional breathing, you try to correct the dysfunctional breathing. So you try to correct the breathing pattern, and you try to inhibit all the accessory muscles, then you initiate the diaphragmatic breathing, half your problem is solved. Because whenever you do all these components together, your work of breathing is reduced, your respiratory rate is reduced, and also your dysfunctional breathing is corrected. So these three are important. And once you start relaxing postures, and once the patient is able to perform little, then you start off with inspiratory muscle training. Only then you can start strengthen the inspiratory muscles, because all these will only improve your respiratory component, but strength will come only when you start the inspiratory muscle trainer. All right. Then the second one is, as a fresher, what are the
Another big option.
basic
Dr.
treat-
Nikhil,
Yeah,
let Dr. Sadhvi take the questions.
sure.
Others cannot read. So when you're reading quickly and answering, others can't understand the question.
Okay, sure.
Sadhvi, please
Okay.
take the question.
Yes, ma'am. The next question is, as a fresher, what are the basic used for COPD in a OPD setup?
As a fresher, what are the basic treatment options which can be used? So most of the times, whenever you see, if there is a COPD patient who has come to you, definitely the abbreviation itself tells that that is COPD, that is chronic obstructive pulmonary disease. So whenever a patient comes to you, you try to do a detailed assessment, complete assessment, and you try to see the vitals. What is the saturation? What is the respiratory rate? Whether it is too high, or chest expansion, or the chest examination of the chest, whether there is any dysfunctional breathing which is seen. Because most of the times the breathing pattern is abdominothoracic in males. So whenever you see if there is a reverse breathing pattern, or there is thoraco-abdominal breathing pattern, you have to correct it to abdominothoracic breathing pattern. So you have to teach all the basic exercises. And what are the treatment options available? So always remember, we use what we call the pursed-lipped breathing on a everyday basis. That is, if you use pursed-lipped breathing, usually what happens in COPD is there is a lot of air trapping which happens. So whenever there is a lot of air trapping, again air trapping, whenever you breathe out, there is a lot of CO2 which is coming out. So whenever there is a lot of CO2, there is a chance of increased respiratory acidosis. So you have to use the pursed-lipped breathing. There's a simple technique. Ask the patient to take a deep breath and ask him to blow for a longer time. That is, for a longer time, and you're trying to wash out all the CO2. With this, you're achieving the homeostasis in the body, so that you're washing out all the CO2. So we don't want the patient to be in respiratory acidosis. So in the initial, you can do this. And the most easiest way is you consult a pulmonologist and start him off with a bronchodilator therapy also. Whenever you use bronchodilator therapy, because there is a spasm, the tubes are like this, the tubes will bronchodilate, and there is easy flow of air. So bronchodilator therapy again becomes really important. So this you can use in your clinic setting. Yeah,
Thank you, sir.
yeah.
The next question is, can pursed lip breathing with thoracic expansion exercises play a role in post-PCI patients?
Yeah, there is something called as, see, whenever you're doing a pursed lipped breathing along with thoracic expansion, this is otherwise called as, there are a lot of articles which tell you that ventilatory movement strategies. So whenever you move your thorax and try to do thoracic expansion, and also move your chest, there is a very high chance that the air will enter the lower basals. So these, in modern articles, they have written as, even in the earlier articles also, this is otherwise called as ventilatory movement strategies. So you're combining your ventilation along with movement to achieve the maximum benefit. So it can be used, and it is very widely accepted, and you will have a very good result. Because most of the times when we see the anatomy or the physiology, your upper lobes are good ventilated, but it doesn't reach the lower lobes. And that is why when you auscultate, you will see good breath sounds here, but not here. So when you use these ventilatory movement strategies, there is very high chance that the air will enter the lower basals also, which is very useful. So you can use this, not an issue. Ventilatory movement strategies are very essential and it can be used widely. Yeah.
Okay, thank you, sir. Next is how to improve breathing in GBS patients.
Yeah, so in GBS patient, usually in GBS patients or in Parkinson's patients, the most ironically thing what happens is usually patients don't go down because of your muscle weakness or anything, because of the Parkinson's component or the GBS component. The most easiest quick way that the patient will come down or decline is because of your respiratory functions. Until and unless you have a proper bronchial hygiene which is being maintained, you will have these hospital episodes keep happening again and again. Whenever you don't have proper bronchial hygiene, make sure you are at least doing twice a day. If the patient is in hospital, it is mandatory, but even at home, teach the patient. If the patient comes to you as OPD patient, teach the patient. That is why education and patient training are really important. Teach the patient about your autogenic drainage, your postural drainage, as well as your corrective breathing patterns and your relaxing postures and all these things. Because whenever we are talking about GPS, you will have the last thing which happens is your respiratory muscles will be completely fatigued and weak, and that is why patients usually get confined to bed and they will decline very rapidly. So it becomes really important, and I have seen on my personal experience that lot of patients come back again and again only because a proper bronchial hygiene therapy was not maintained. I was telling earlier, if there are a lot of secretions in your airways, obviously there is increased airway resistance, and because of this there is a very high chance that infection can happen. And if the infection happens, you will have frequency of the hospitalization as well as the length of the hospital stay is also very high. So if you have a proper bronchial hygiene therapy, then you can avoid and you can treat the GBS patient and start him on devices like PEP devices or forced expiratory technique and all these things. It is little tough initially, but once the patient start doing it, it becomes easy. Devices like acapella or flutter, they send in vibrations, try to loosen the mucus, and then the patient, it becomes easy for the patient to expectorate. Then you will have a very clear bronchial hygiene, the airways. Whenever you have clear airways, you are in a good hands. All right?
Yes, sir.
Yeah,
Thank you so much.
yeah,
I think this is the last question.
yeah.
Please elaborate on the importance of lower limb strengthening in respiratory patients.
Yeah, so yeah, ideally, the most important thing, this is really a good question because most of the times we focus on the upper limb strength. But whenever we are talking about a respiratory patient, if at all he is using his upper limbs more and more, the ventilatory effort is very high, and also there is a very high chance that patient will become dyspneic very fast. I don't want patient to become dyspneic, and I don't want, if the patient is able to do 20 repetitions, I don't want the patient to end with 10 repetitions. So that is the whole and sole reason why we focus more on your lower limbs. And whenever I'm talking about the lower limbs, as we all know, the front of the thigh, that is the quadriceps, it is otherwise called as the peripheral lung. So it is the biggest muscle which uses most of the oxygen which is present in the body. So whenever you're working with your quadriceps, that is you're either cycling or whether you're doing leg extension exercises like dynamic quads with weights on, so what happens is it utilizes oxygen which is present in the body. So there are certain receptors, that is you have receptors, the dorsal respiratory group, ventral respiratory group, apneustic center and pneumotoxic center in your brainstem. All these are the respiratory centers. And whenever you have one sort of hypoxia state, these receptors, these chemoreceptors sense it, and they send signals to your brain telling that you need to breathe better. So whenever you're working on your quadriceps, because the quadriceps uses maximum oxygen, you will start using the oxygen which is in the body and you will start breathing better. That is the reason why automatically, indirectly, your breathing pattern is also getting corrected. Breathing pattern is getting corrected, and your breathing efficiency is getting corrected. You you are asked, you are forced to breathe more and more because your oxygen is getting decreased in the body. So that is why we focus more on lower limb strengthening rather than upper limb strengthening in patients with respiratory illness.
Okay, sir. Thank
Yeah.
you so much, sir. I think that's it with all the questions.
Yeah.
Thank you so much.
And thank you so much for the opportunity. I hope this session was useful. I hope most of the young therapists or budding therapists, because it's been like 10 years for me that I have been working with cardiopulmonary patients. So few things I have taken from textbook and few things it was from my own experience. And I appreciate whoever was there, the audience and the participants also, especially on a Saturday evening. They have come for this brainstorming session. Thank you so much. I hope this session was useful. Yeah.
Dr. Lavi.
Yeah. Yeah, thank you much. Thank you so much, sir. This session was almost very useful session. I feel very gratified for having been given this opportunity on the behalf of IAP Women's Cell. Present the vote of thanks for today's webinar. I would like to thank today's speaker, Dr. Nikhil Chakravarthy, sir. Thanks for the beneficial explanation. I want to take this opportunity to thank IAP Central Committee for providing us this platform. And I also express my sincere gratitude to the technical team and our IAP Women Council and all members of IAP WC Goa for the relentless efforts and time towards the Women's Council. Last but not the least, I appreciate our attendees for taking their time out and making this webinar a successful event. I am sure today's webinar was a very great learning experience. I hope you all have a great day and have a wonderful weekend ahead. Thank you so much, sir, for your valuable talk.
Thank you so much. Thank you for the
Thank you,
opportunity.
everybody, and especially to our speaker, and also the audience who has still come in good numbers while we are conducting it in the evening, while somebody's dinner time. We are still trying to have our sessions over here, and people are still coming. I think one question which was left out, is there any special suggestion to new MPT cardio students? I think you can finish with that, Dr. Nikhil. Your questions are not ending. That
No,
people has been very much engaged. We generally see after the webinar that the number of attendees suddenly come down, but we have maintained our number of attendees.
very nice, very nice. That too on a weekend. I appreciate that.
Yes, yes,
That is giving me more enthusiasm actually.
yes.
So yeah, is there any suggestion for new MPT students? See, the most important thing is always, as I say to most of my newcomers also, keep it very simple and always make sure you are thorough with your basics. You need to be very thorough with your anatomy, your physiology, and also the assessment part. Once you know a proper assessment, then it becomes very easy for you to deal with any sort of patient. And as I told you in the mid seminar also, the most important, which is very much lacking in modern day generation, is communication. Physiotherapist cannot treat effectively if he doesn't communicate. So the most important part would be how effectively you are communicating with your patient so that he understands you in a better way, and you will be able to teach him very nicely. So the communication should be there, and your personal interpersonal skills. So always remember, you if there is a webinar or a seminar, try to attend it, try to learn something new. Whenever, most of the times, I tell my colleagues or my students also that once in a week at least try to read an article, try to understand how much ever little you can, so that you will be in that process and you will get into that zone. Eventually you will get better. So take it step by step. Yeah.
Thank you so much, Dr. Nikhil. Now we have come to an end
Yeah,
to
thank
this.
you so much.
Thank you. Thank you all.
Yeah,
Happy weekend.
thank you everyone. Happy weekend.
And we are joining tomorrow again for another webinar at 9:30. Please join us tomorrow as well. Thank you.
Thank you everyone. Thank you.